Pediatric gastroenteritis. Most often, diarrhea and vomiting in children is caused by a virus. Some people call these stomach flu or food poisoning. Diarrhea is defined by passing 3 or more loose or watery stools in a 24-hour period. This usually lasts between 2 and 7 days and will usually resolve on its own. Common symptoms include belly pain and cramping, nausea and vomiting, fever and chills, and watery loose stools. The most important thing is to keep your child well hydrated with plenty of fluids. Some signs of dehydration are dry mouth, lack of tears, and decreasing amount of urination. Some tips for home care are: drink plenty of fluids and rest. You can use oral rehydration solutions that are sold over the counter. Do not use over-the-counter diarrhea medication unless approved by your pediatrician. You can use acetaminophen or ibuprofen to control the pain and fevers. And please do not use aspirin, as this can cause liver damage and a life-threatening condition called Ray's syndrome. Things you can do to prevent the spread of this illness are: washing your hands and your child's hands frequently to prevent spread. Keep your child out of daycare until your child's healthcare provider has said that it is okay. Washing your hands before and after preparing food. Wash your hands and utensils after using cutting boards, countertops, and knives that have been in contact with raw foods. Keep uncooked meats away from cooked and ready-to-eat foods. Keep in mind that people with diarrhea or vomiting should not prepare food for others. Some tips for what your child can have when they have diarrhea are: having clear fluids such as broths or rehydration solutions like Pedialyte. Avoid giving milk, as it can make diarrhea worse. Avoid drinks with high sugar or artificial sugar contents like juices or fruit drinks. They can make the diarrhea worse. Have foods with high fiber. Some tips for the diet for your child who is vomiting are: offer small amounts of food or liquid and just give those more frequently. Start with oral rehydration liquids such as Pedialyte and slowly advance to solids as tolerated. Do not force your child to eat if they are vomiting. Solids are less important than drinking fluids. Things to look for and seek medical care for are: fevers greater than 38 degrees Celsius or 100.4 degrees Fahrenheit, blood in the vomit or stool, worsening abdominal pain, especially if the pain is predominantly in the right lower abdomen, persistent vomiting with inability to keep anything down, a new rash, persistent severe diarrhea or vomiting for more than 24 hours, change in mental status or fussiness that is not getting better, dark urine or no urine for 6 hours. Otherwise, please always follow up with your pediatrician for a checkup.